At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. My name is Donna Cryer. I am the founder and CEO of the Global Liver Institute, and I have the privilege of being your host for this episode of GLI Live, part of our October is for Livers series on such an important issue today, which is advancing health equity within and through nursing. And for this important conversation, I can think of no better guest and co-conversationalist than Dr. Sheldon Fields, who is amongst his many accolades and titles, Associate Dean for Equity and Inclusion for the School of Nursing at Penn State. And also, I feel like this is where we want like the Zoom balloons and cheers and thumbs up to start, surprising us. But also the 14th National President of the National Black Nurses Association, an organization that is near and dear to my heart, personally and professionally. And I hope after this episode is near and dear to you all. Welcome, Dr. Fields.
Thank you, Donna. I'm absolutely delighted to be here today. Thank you for the invitation.
Absolutely. So certainly almost 30 years post liver transplant, I would not be alive without high quality nursing, and particularly the extra loving care and attention and time that several Black nurses have given me throughout my patient journey. So I thank you. Tell us what the National Black Nurses Association does.
So the National Black Nurses Association has been around since 1971. We have 113 chapters in 34 states, including the District of Columbia. In our recent conference that just ended at the end of July, we actually founded a new chapter and added the state of Iowa. So we are all across the country, all across the nation. We operate nationally. We initiate our work and do our work in these local communities where people live, work, learn, die, and play. And we are a group of professional nurses, and from the LPN level all the way up to advanced practice nurses, doctorally prepared nurses in all disciplines and areas of the nursing spectrum and discipline. All of the clinical areas. We have educators, we have administrators, we are everywhere, but with a very specific owens in a tradition within Black and other people of color communities.
You know, I think of the moments in healthcare from the professional side that I've been proudest of. And one is, as I sit on the board of a hospital, to have played a role in the hiring of a Black chief nursing officer. And when I see the effect that she has had across the institution, across all the patients and across our C-suite level and board level conversations, it's really, there's no place that has not been improved by her presence and her professionalism. So I think it's just one of the many examples of your members. And you do have that dual mission within you, both to elevate the Black nursing and healthcare workforce, some great Black jobs there, and if I might say, and also to improve the health of African American patients and all patients who are under your care. So how do those two missions play out, particularly in your role as president?
Yeah, so our mission is very clear. We're here to support those nurses who do identify as Black along their professional journey. So we have mentorships and we have scholarships We do a lot to support each other through our journeys in nursing. I myself have been a nurse this year for 33 years, a nurse practitioner for 26 years. So, everybody needs a mentor, no matter what level you're at or what level you're trying to get to. We even allow students to join, and we provide scholarships. This past year, to the tune of almost $400,000 in scholarships. So we are really fortunate. But we have a very specific mission to elevate and give access to healthcare to those historically underserved brown and Black communities, and to serve as that connection, and to serve as advocates, and we're very, we take that mission very seriously, and we're focusing on, we have a focus at the national level on certain issues that have really bubbled up to the top. One of which, of course, is organ procurement, and the fact that, within the African American community, there is a lack of education about how to do organ procurement, how to do donor, and the need around certain organs is higher in African American communities for certain diseases. So we partner to do those types of educational programs. We're leading this major initiative around educating people about Black maternal health, which is an issue, and anything else that comes up that disproportionately affects us, whether it be things like sickle cell or HIV. We are everywhere, because we need to. And sometimes we need to be that voice where people don't feel they have a voice, and that connection to health and healthcare.
I absolutely, agree. As a patient, it's a very vulnerable place, and often, the nurse is your voice to physicians and to others. Your nurse is your protector and your translator at the hospital level, and so. But it's also exciting to be your partner at the national level, fighting for those policies, particularly organ transplantation modernization, which we have moved forward incredibly under the Biden administration. And I am excited to continue to be able to have the data on how transplantation particularly plays out amongst African American populations, both on the donation side and the transplant survivorship side as well. And your partnership in that and your leadership in that has been really fundamental to our success of late on all of those issues, and bringing that to people's attention. Certainly, I think people are aware that kidney disease and chronic kidney disease, dialysis, and kidney transplantation is a role, and liver transplantation also. Particularly when you start to talk about getting on the list and surviving on the list, and surviving past the transplant, where our rates may not be the same. That we need attention, nursing policy, nursing leadership, all the way through that process. That's the only way I've made it to 29 years and counting post liver transplant.
That's amazing, by the way. That is absolutely amazing.
Thank you. It's a privilege to be able to live long enough and to be healthy enough to advocate, and so we do. I'll be very excited. By the airing of this episode, to be have been joined on Capitol Hill by an increasing number of our Advanced Advocacy Academy graduates. And one of the strategic decisions that we make was not to just have it for patients and caregivers, but also to invite transplant coordinators, advanced practice providers, and other, as you've talked about, the spectrum of nurses. Because they often are the voice for patients, and understanding how to advocate on patient identified issues is really important in that.
Mm. Well, one of the major initiatives of MBNA, and I know you're familiar because you know the work that we do,
Mhm.
for 30 plus years, 35 years, MBNA holds an annual Black Nurses Day on Capitol Hill.
Yes.
And you can mark your calendar. The first, the first Thursday of February every year, to coincide with the beginning of Black History Month, we hold our Black Nurses Day on Capitol Hill. That is our professional advocacy day. That is when MBNA takes its legislative agenda directly to the representatives in Congress. And we make those meetings with our representatives in both the Senate and the House. We spend a full day. We do prep. We invite speakers to come talk with us. We invite the Congress members to come and address us directly. And over the years, we've had several of them take advantage of the opportunity to talk to us and our membership. But we champion certain issues. Again, we've worked directly with Congresswoman Lauren Underwood with the Momnibus bill and everything around Black maternal health. We have been mentioned in the podium by Nancy Pelosi for the work that we do with tobacco-free kids and our issues around smoking cessation and rehabilitation for those who are dealing with addiction from tobacco. We advocate for the environment. We've been very clear about our stance in access to mental health and those issues, anti-gun violence, advocating to make sure that we have educational programs and funding to help support the education of a diverse nursing workforce. So we take that day very seriously. We show up in mass, and it has been incredibly effective. And our Black Nurses Day was a brainchild of one of our former MBNA presidents, that is Dr. C. Alicia Georges. And we owe her a debt of gratitude for helping us to establish that day more than 30 years ago.
Your issues are our issues. And so we will be marking our calendars and supporting in any way we can. I think it's particularly important when you have a new Congress, a new administration to educate and to reorient you to your issues and to create new champions and re-engage long-term champions. One of the things I think about is, I can count the number of physicians in Congress. Have there been, will there be Black nurses in the next Congress?
So, a lot of people don't know that the very first nurse ever elected to Congress was a Black nurse. She recently passed away, but Edie Bernice Johnson came to us as a representative from Texas. She was the first nurse ever elected to Congress, and she served for many, many years.
Yes.
And at the end, at one point, there were 3 nurses in Congress serving: Edie Bernice Johnson, Lauren Underwood, and our colleague from Missouri, and I'm going to forget her name at the moment, Cori Bush. Cori Bush. And even though Black nurses are not the majority of nurses in this country, all 3 nurses serving in Congress were African American. And the very first nurse, again, was African American.
I think that just shows how nurses, show up and stand up for people, for their communities, and serve in every way that is necessary.
Yes, but and I myself, I had served as a Robert Wood Johnson Health Policy Fellow. So back in 2009. And that year was really important because it was the first year of the Obama administration, and we did healthcare reform. So I was a health policy advisor to the then Senator Barbara Mikulski, who was the senior senator from Maryland. Most people are familiar with her work because she championed the Senate Nurse Caucus, and she had jurisdiction over the Health, Education, and Labor and Pensions Committee in the Senate that had the major jurisdiction of passing Obamacare or the Affordable Care Act in the Senate. So I had a first row seat to the passage of healthcare reform. I am a health policy expert, and which is why I take our Black Nurses Day on Capitol Hill very seriously. I chaired the committee for NBNA for several years before I became president. Everything in healthcare is related to policy and good policy. And good policy is also equitable, and it's also diverse, and it's also inclusive. So these are the things that we continue to fight for. But nurses make really great potential candidates for office, and I really wish that more would run for office because we could really change a lot.
I think maybe we'll send this message to Emily's List and a few other places. As the daughter of school teachers, nurses were sort of our hand in hand in terms of who's going to get something done. And so, in all cases, in our churches, in our communities, and so I think elevating people who have that lived experience, who have that sense of servant leadership, and also who understand something as important and complex as healthcare is to every individual person. We do need more who have that experience in making our laws about those issues. So I'm in. One of the issues that you mentioned, several times, is, Black maternal health, and I think in this current climate, I think the conversation around that often has been skewed. Can you talk about your work in this current climate and what things and types of policies and actions actually do support Black maternal health?
So most people should know that brown and Black women die at almost 5 times the rate of their white counterparts in normal childbirth. And this statistic is absolutely egregious because most of what we're finding is these instances are preventable. So, we have stood by a Congresswoman Lauren Underwood, who has submitted a suite of bills called the Momnibus Bill. And it's all about legislation to combat Black maternal health and the various issues. Everything from how do you get money to support the addition and the diversity of the reproductive healthcare workforce. So everything from nurse midwives to doulas, being able to get them the education they need, because we also know that when there are Black nurses and midwives and other people involved in that birthing process, we get better outcomes. And we need more. There's not enough. Everything from how do we also make sure that there are birthing centers and people in the communities where that are accessible? How do we encourage early in instances of getting access to good maternal health care during the pregnancy, through and post the pregnancy? How do we even do that follow-up to make sure that mom and baby are getting what they need after a successful delivery? Everything from making sure that within the military that the women also have access to everything that they need. And we're also talking about reproductive health justice as well. SCOTUS with that Dobbs decision has done a lot of damage because people like to think, oh, that has nothing to do with this. No, it does, because now we're talking about the spectrum of care, and that includes reproductive health. So we are very supportive. Um, as part of my presidency for NBNA, we stood up a more intensified Black maternal health committee within NBNA that are doing national webinars and educating people. That initiative, led by Dr. Lucinda Canty and Dr. Camilla Barnes, that are both NBNA members, has been doing a lot of work with our various chapters throughout the country, educating people about the Momnibus Bill, the resources that are available, and educating about the various topics related to the issues of Black maternal health, and making sure we elevate the conversation, that people are aware that this is a national crisis and we need to be doing more.
I smiled, particularly when you mentioned birthing centers, because long ago and far away, earlier in my career, I created a preterm birth risk reduction program. And I really fought to have the event at the last remaining birthing center, standalone birthing center in Washington, D.C., in a neighborhood where, you know, the Black Escalades that ultimately pulled up seldom come. And it was important for me to do the event at the birthing center in the community. There were moms nursing in the back of the room saying, who are these people from, you know, CDC or, you know, health insurance company, you know, X or Y. I just really wanted to, one, point out this was the most excellent program with the best numbers. This was where the solution resided, and more of a strengths-based and asset-based approach to viewing the community, but also to connect and to say this is you should be coming here and you should be asking for the advice. And so it was. You know, I'm really proud though that the program still exists, even though the permutations and the buyouts and mergers and things of the health insurance plan, but that program still exists 20 years later, because it works, because it is focused on the strengths of the community to have solutions and working, you know, in support of women's health. And and so it the fact that it still exists is a, you know, a point of pride to me. But it became from listening to a nurse midwife, asking a nurse midwife what the answer should be, and putting then the resources behind that answer. So it's incredibly important, the work that you're doing, and we should all be paying attention, because this isn't just an issue for poor Black women, as some people think. You know, Serena Williams had problems in her pregnancy.
Beyonce had a problem.
Beyonce had problems that it wasn't listened to. And so and you talked about normal pregnancies, and even more so with you know, women who have hypertension and other issues that are more prevalent in our communities as well. And so, you know, the thought of you know, women's health across the spectrum being family health and very much inclusive of reproductive health. It's not something that's sort of out there over there. It's something that's very much a part of women's health and families' health, our community's health, and our national health. So yes. Thank you for your leadership on. We will take your signals.
It is our absolute pleasure. And it's an issue that we could not ignore. And as NBNA, we will not ignore.
Absolutely. Absolutely. I, you know, during COVID, you know, when the rules were around, you know, no one could, you know, you couldn't have a care partner, they called them visitors at the time, and with someone, and, you know, someone I cared about, you know, needed to be there. And, you know, I was like, that just doesn't seem right to me. I'm like, care partners are so important to watch, to help, to reach as extenders, as, you know, as extra observers. And I remember calling several people, you know, in our network in healthcare, you know, many of whom were, you know, physicians and high-level clinicians and things like that. And they're like, oh, nobody should be in the hospital by themselves. I'm just like, that's my point. And so, but it was still, you know, what we had to do was, you know, working with, you know, as an external, I remember passing things to the nurses and being like, you know, please please take care of my loved one and communicate back to me, what I need to do to make care on the other side. And so that what we always try to teach is that emphasis on, the physician's great and we love our doctors and everything, but don't forget about the important role
Yeah.
of nurses there at the
Well,
bedside and in intervening in so many different places and as that key
yeah.
point of communication and advocacy within and without.
So we were very involved during COVID as an association.
Mm-hmm.
We were intimately involved in the work of the Black Coalition against COVID. Our
Mm-hmm.
president at the time was Dr. Martha Dawson, who
Yes.
really did a yeoman's job of leading us through that tragedy and through that time, really standing up programs to get PPE to nurses, because at the very beginning,
Mm-hmm.
we didn't have what we needed, particularly as we realized the pandemic disproportionately started to affect Brown and Black communities. Again, no big surprise that these places were under-resourced in many ways, in terms from their workforce to the actual monetary resources. Even by the time we got to the vaccines, in terms of, well, how do you distribute them and make sure that they get to those communities? So we stood up pop-up clinics. Some of our chapters did. We manned them, we worked them. And it was all very important because, again, our healthcare system is incredibly unequitable. And we've known this for quite some time.
Mm-hmm.
And it's this constant battle of going back and forth, reminding people, and then standing in as advocates and being those frontline workers that nurses are.
Yes. And I think actually we have one of the earliest episodes of GLI Live was with President Dawson. And so if anybody would like to go into the GLI Live archives on YouTube, you can see my hair is a lot shorter, but and the image is much grainier, but the information is still sound. And it speaks to how much this work takes time as well. Some of the initiatives that you've named have been in the works across several administrations, congresses, presidents of your organization and mine, but they're still they're worth pursuing. I have a bills signing pen to count at least for success in some issues. And so, the arc of history is long, but it bends towards justice. It's put it like if you put a little shoulder into it and help it bend. What are you most excited about? I mean, I know we're signing up for the Omnibus Bill. We're putting our February your Hill Day on our calendars. But what else should we be doing, and what else should we be thinking about as liver patients? With our nurses at any of the levels in which we intersect.
Representation always matters. So, and we need to make sure that the nursing workforce resembles the overall general society that we are. The nursing profession is a lot of things. We're the most trusted profession, but we at almost 90% women and 80% white, the nursing profession continues to not be ethnically, racially, nor gender diverse. And again, in those places and spaces, not only when it comes to those nurses who work in liver transplant or any organ procurement system or any part of our healthcare workforce, the literature is very clear. If you have a diverse nursing workforce, patients have better outcomes. When patients can relate to some way, to some characteristic of their healthcare providers, such as nurses. And nobody touches the patient's lives more than nurses. So we need funding. We need to make sure that we are getting nurses into nursing school, through nursing school, that they're graduating, that they're passing their NCLEX. So, we also work with the annual appropriation to Congress, and we also advocate for all of those federal dollars that come through and for and support of nursing education. And we need more. because, we always seem to be having this cyclical shortage of nurses. There's never enough. And there's never enough brown and Black nurses because we do not have the numbers that we need. And we do not have the numbers that we represent in our general society.
So, certainly as the daughter of a middle school science teacher, there's no reason that a good portion of his class couldn't have gone into some spectrum of nursing careers. And so I think that as we talk to, every generation about, presenting this as the opportunities, and particularly as you see so many nurse leaders in just a variety of positions throughout the healthcare ecosystem making a difference. It's not just one thing. It really is a potentially transformative career choice.
Well, one of the things that we've done at MBNA, and again, the brainchild of President Dawson, she has really stewarded and stood up a program called the Mini Nurse Academy. And what that is it's a program that goes into elementary schools and teaches those third, fourth, fifth graders about what nursing is. Because if you think about it, if you that sort of exposure to what you can be when you grow up, and you ask those kids at that age, they're likely to say, oh, I want to be a fireman, I want to be a cop. No third grader goes, I want to be a nurse, because they haven't been exposed. Right. So this program, which is a national program, we partner through our chapters. And again, we have 113 chapters, and they choose a local school. It's a national curriculum. And it's over a certain amount of time. We partner with the school. We get the principals involved, the school teachers, and we go in and we have multiple sessions around nursing, teaching them what we do as nurses. Sometimes it's the first time they've ever seen a nurse that looks like us. Particularly for some of the young men, it's the first time that they'll ever see a male nurse as well, because, we're not the norm. In that program, we want to continue to expand. We want a mini nurse academy in every single chapter where we are, but it's going to take resources. So we are constantly trying to encourage grant writing and to get more resources. We would love for any major corporation out there to help fund the program. This way we can continue. Yes, I hope they are. I hope they are. And if anybody is interested, just go to mbna.org and send us an email. We will gladly talk to you about this phenomenal program because we got to get to them early. By the time these kids get into middle school, and definitely by the time they get into high school, some of them are already set on their career paths, and they've never considered a career in professional nursing.
Well, I think now they should. And so that's a fantastic note to end on. I look forward to seeing more Black nurses in this next generation. Thank you. Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.